Hello, my name is Mary Martin, Senior Vice President of Customers and Markets for Surescripts. I'd like to thank you for joining us today for the 6th Annual Safe-Rx Awards. Once a year, we hold these awards to recognize the leadership of the states that have made the most progress in moving from paper prescriptions to e-prescribing. The Safe-Rx Awards celebrate their accomplishments in advancing healthcare safety, efficiency, and quality. This year, we're excited to share these results in this online environment you're watching right now. As always, for support about e-prescribing, visit the Surescripts website or call 866-RX-READY. Okay, let's get started. First, a few words about Surescripts. As many of you know, Surescripts operates the nation's largest e-prescribing network and supports a rapidly expanding ecosystem of healthcare organizations across the nation. We were founded by the nation's pharmacies and PBMs to improve healthcare in America by improving the safety, efficiency, and quality of the way medicine is provided to millions of Americans every day. To get a better understanding of how explosive the growth of e-prescribing is, all we have to do is look at the numbers. How about this for starters? Just this past September, we reached a major milestone. A majority of physicians in the U.S., over 51%, e-prescribe. This is a 5-fold increase from just 3 years ago, which brings us to over 350,000 e-prescribing providers today. This growth in physician connectivity also tracks to EHR connectivity. Surescripts connects over 200 EHRs to allow easy movement of electronic prescriptions. But our story goes well beyond connectivity. We've also seen a tremendous amount of growth in the use of e-prescribing as a practice. This year, we're projecting that over 500 million prescriptions will be sent electronically. By the end of this year, approximately a third of all prescriptions in this country will be sent electronically. 2 other vital numbers illustrate the growth of e-prescribing use as well. First, e-prescribing will help increase the amount of medication histories given to prescribers. This helps them write safer prescriptions. And second, e-prescribing helps incorporate the patient's benefit and copay information into the physician's workflow, so they can write better and often more cost-effective prescriptions. As you can see, we anticipate a very significant increase there as well. There's no doubt about it, e-prescribing use is on the rise. Moreover, it's a collaborative effort between community pharmacies, PBMs, health plans, technology vendors, physicians, and federal and state authorities who've all played a key role in making e-prescribing a success. Best of all, we're seeing this growth occur in all 50 states, large and small. The Safe-Rx Award Top 10 winners that we'll be announcing shortly have obviously achieved the highest levels of use, but we're very excited to see the broad-based growth around the country that all states are experiencing. We encourage you to visit the Surescripts website at the URL on your screen to view your state's progress report once the webcast has completed. It's sure to provide you with valuable data and insights. While this explosive growth in e-prescribing is exciting, it takes on an even greater importance when we consider the positive impact on the quality of care and the savings that it's generating for the healthcare system. As we celebrate the progress of e-prescribing, we think it's important to recognize significant strides made by many of the states. This year, there are 2 states in particular that we wanted to highlight, Wisconsin and New Mexico. These 2 states didn't quite break into the top 10 this year, but we did want to recognize their respective achievements and how rapidly they advanced in our national rankings. Wisconsin moved up a full 13 spots from the 31st position all the way to the 18th. Dr. Jeffrey Barr of Aurora Health is here from Wisconsin to talk about how they achieved these great results.
Well, my organization, Aurora Healthcare, represents the largest physician group here in Wisconsin. And as we take our Smart Chart initiative system-wide, you're only going to see the use of e-prescribing habits go up. And I think once the convenience and the cost savings are realized system-wide, it's going to become even more popular. And the benefit to the patient as well. Within an integrated health system like ours, the e-prescribing is a natural fit. And so you're going to see increased patient safety, increased cost benefit, increased convenience to the patient, the physician, and the third-party payers as well. So I see those numbers continuing to trend upward.
Equally impressive is New Mexico's performance. They jumped from 43rd to 27th, a full 16 position. Here's Galina Prilitskaya from the New Mexico Medical Review Association to share how they made it happen.
I think it's actually kind of complex of different activities that are happening right now in our state. We are working with New Mexico Prescription Improvement Coalition. It's a statewide effort that was initiated in 2006 by few health plans and NIMRA, as well as Medicaid and other agencies. We started with 25 members as of 2006, and by 2010, our numbers of partners growth, and right now we have 185 partners, and it's still growing. And we initiated e-prescribing pilot as a part of our first intervention in 2007, and we did it in multiple phases.